Hello, folks. My name is Kevin Douglas Berg. This is What Was I Saying blog KDB, and I am here to provoke thought and move humanity just a little bit. I do weekly segments on particular areas of interest, as well as hot topics that I find as I just look through stuff during the day. Put this under health and things to look out for. Unfortunately, under the drug abuse illegal sections. Here we go. I heard about this in Australia, and then I wanted to see if we had any instances of this. They're called nitazines, and are a powerful class of street drugs emerging across the U.S. This is from February 15th. 2 deaths in Boulder County in 2023 are the latest in U.S. to be blamed on the powerful class of a synthetic opioid called nitazines. Most health systems cannot detect nitazines, so the exact number of overdoses is unknown, but they're implicated in more than 200 deaths in Europe and North America since 2019, including 11 in Colorado since 2021. One of the 2 Boulder County deaths is linked to a new formation called N-diacethylamine idonatazine, which is identified by a national laboratory and is thought to be the first related death. The conversation interviewer, Dr. Christopher Holstedge, professor of emergency medicine and pediatrics at the University of Virginia School of Medicine and director of the Blue Ridge Poison Center, where opioid overdoses are increasing, unfortunately. He explains why nitazines are so potent and deadly. What are nitazines? Nitazines are a class of synthetic opioids that contain more than 20 unique compounds, including isotonitazine, which was first identified in 2019 and is known on the streets as ISO. It also includes pronitazine, metanitazine, and idonitazine. Nitazines are psychoactive substances or designer drugs that aren't controlled by any laws or conventions but pose significant health risk to the public. These substances have recently served as illegal drugs. Researchers have relatively little information on how the human body reacts to nitazines because the drugs have never been gone through clinical trials. But lab tests show nitazines could be hundreds to thousands of times more potent than morphine. Who are the bastards fucking making this shit? Seriously. We don't fucking need this bullshit. Sorry. But lab tests show certain nitazines can be hundreds of thousands of times more potent than morphine and 10 to 40 times stronger than fentanyl. The U.S. Drug Enforcement Agency has classified many formulations of nitazines as Schedule I drugs under the Controlled Substances Act, meaning they have no medical use and a high risk of abuse. When were nitazines first developed? Nitazines were initially developed in the 1950s by pharmaceutical research laboratories of the Swiss chemical company CIBA Octangesellschaft. It synthesized numerous substances in the drug class to be used as painkillers. However, nitazines were never approved by the U.S. Food and Drug Administration for medical use in humans. They were nearly forgot outside of specialized research circles until they emerged as street drugs in 2019. As law enforcement has cracked down on drugs such as fentanyl, illegal labs have used historical pharmacology research to formulate analogs of nitazines as street drugs. Since 2019, at least 6 formulas have come from the original patent, but others, like the one detected in Boulder, are brand new. Specialized lab testing is required to identify nitazines in toxicology samples, and fentanyl test strips can't detect nitazene analogs. But since first being detected, nitazines have been blamed for 200 drug-related overdose deaths in Europe and the United States. Although nitazines are now identified as an illegal street drug in numerous countries, many medical providers aren't even aware they exist. What types of nitazines are showing up on the streets? Nitazene first appeared in 2019 in the Midwest as a white powdery substance similar to cocaine. It later appeared on the streets of Washington, D.C. as yellow, brown, and white powders. Since 2022, the DEA has found other types of nitazines in both powder and blue tablet forms. Nitazines are also mixed with street drugs, such as heroin and fentanyl, and with fake oxycodone pills without users knowing it. The Justice Department has indicated several companies in China alleging that they ship the raw chemicals to nitazines to Mexico and the U.S., where they get mixed by cartels and traffickers, then distributed on the streets. What are the signs of a nitazene overdose? The toxic effects of nitazene resemble those associated with classic opioids such as morphine and fentanyl, and include small pupils and slowing of the respiratory and central nervous system, which can lead to death. Because of the potency of the nitazines, symptoms can develop rapidly after someone is exposed, killing them before they can get medical care. Does naloxone counteract the effects of the overdose? Naloxone, commonly known as Narcan, is reportedly effective in reversing overdoses to nitazene, but larger and multi-doses might be required. No, like we don't have enough shit. Latest designer drug bullshit, and they make it a schedule whatever, and they find it, and then they go back and these fucking assholes, they go back and they reformulate it or whatever, and then it's something different, and it's something different, and something different. Got a special place in hell for those motherfuckers. You gotta be honest. And don't say, oh, if I didn't sell it, someone else would. The fuck? I don't know what kind of morals you have or any kind of scruples. You are creating something that kills. Like that. On the fuck purpose. Intended. My name is Kevin Douglas Berg. We don't really need any more of this bullshit. Okay. With that, that was just a weekly segment of something interesting I found out relates to health. I have something else that relates to health too, but it's another video. I'm going to do it right now. I'm here to provoke thought, move humanity just a little bit. Thank you very much. Let's pray this out. Pray for you, pray for me, pray for everybody that is on a plane, train, automobile. Pray for those that are serving, post-serving, and fighting with PTSD. Pray for all military, all uniformed people, policemen, policewomen, all rescue people, firefighters, first responders, as well as those in the hospital wanting a better day. Pray for all doctors, all medical staff, as well as those who do not have food, do not have shelter, do not have water, do not have clean facilities to go to the bathroom and clean up, and to get checked by doctors. Hopefully tomorrow they find more compassion than they did today in the world. Pray for you and me, world peace. My name is Kevin Douglas Berg. I'm here to provoke thought and move humanity just a little bit. Thank you so much.